So recording in progress, great. So just welcome everyone to the July TAG meeting for the Cost Growth Target Program. Next slide, please. So we have a pretty short agenda today. We're just going to go over a summary of our meeting from last time, from June. Share a few quick program updates, and then basically we've left the rest of the time for payers to stay on, for data submitters to ask any questions that they have about this year's data submission process. Next slide, please. So here's a quick summary of what we talked about in June. The two main agenda items were first a summary from Summer Boslow from the OHA Transformation Center on the primary care value-based payment model that she helped to develop. That was at the initiative of the VBP Compact in partnership with the Primary Care Payment Reform Collaborative to give payers and providers some tools to be able to implement value-based payments. So she provided some details, and you can find a summary of those details on the recording of the presentation on the Cost Growth Target website from last time. And then if you have any additional questions, I've provided her email there, and she's happy to converse with you about that. We also had a continued discussion on Cost Growth Target accountability mechanisms. The performance improvement plan draft guidance and template were shared prior to the meeting, and we requested feedback from TAG participants. We're still collecting feedback, so you're welcome to send any feedback that you have. If maybe you didn't have a chance to look those materials over previously, they're up on the website with materials from last month's TAG, and you can send feedback to our healthcare cost target email inbox. We also had some continued discussion on financial penalties and shared a couple of updated methods of calculating the penalties. Thank you for your feedback during that discussion. We also heard your request to have some example calculations with the different methods we presented. And we are working on that, but we are also kind of retooling a little bit after the Cost Growth Target advisory meeting last week, during which we got some additional feedback on the financial penalty calculations. So next slide, please. So we have a couple program updates, and I'm going to turn it over to Sarah and then Zachary to provide the first few updates for today. So next slide, please. And I think, Sarah, it's over to you.
Yep, thanks, Margaret. So we had our July advisory committee meeting last week. The materials and the recording have been posted online if anybody is interested and wanted to listen and missed it. There were three main topics on the agenda. The first was a little bit of a debrief from the May public hearing and planning for the September public hearing. That'll be September 14th, and I'll talk more about that in a second. There was also a presentation and an update on the value-based payment compact work group, the revised targets, and the model development, some of which was shared with you all last month as well. And then the rest of the discussion was about the accountability development. So shared a lot of the information and conversation that we've been having with you over the last couple months about the PIP template and guidance, about different options for calculating financial penalties, and some initial reactions from the committee. Next slide. So a little bit more detail on the September 14th public hearing. So at our committee meeting last week, we shared the very high level agenda. This is going to be a virtual meeting, same as May. We are going to be focusing this conversation on 4 panels, 2 payer panels, 2 provider panels. Each panel is going to be probably about 30 minutes, and the discussion is really going to focus on 2 main questions for each panel. The first will be some reflections and discussion about what cost growth in 21 looked like on the ground for each of the panelists' organizations, and then some discussion about what are these payer and provider organizations currently doing to address cost growth, and what are they looking at doing or considering doing moving forward. So that could be value-based payments, that could be other things. So this is the draft agenda, and we have begun inviting panelists and moderators. So some of you received an email from me in the last couple of days, and some of you will continue to hear from me in the next couple of days as we get those invitations out. If you are interested in being a panelist and you want to volunteer your organization, I know that sounds kind of like a long shot, but a couple of you have actually volunteered. If you're interested in being a panelist, let me know as soon as possible. But otherwise, we are working through a list of payers and providers that we've identified. We're looking for a mix of which markets are represented. We're looking at a mix of in-state organizations versus the larger national payers. We're looking at a mix of smaller independent provider organizations, as well as FQHCs and pediatric practices, as well as our larger provider organizations and health system representatives. So it's a mix. We'll see how it goes, but more information coming out soon, and invitations and conversations with potential panelists have started. Any questions about the public hearing? Okay, next slide. We also shared with the advisory committee just some progress that the cost and equity work group is making. So this work group has had 3 meetings to date. It's a work group consisting of members of the advisory committee, and they are working on ways to further integrate equity into the cost containment body of work. So the cost growth target program, the advisory committee work, the TAG work, as well as efforts to address cost growth and how we can bring these two conversations a little closer together. So there is a draft framework that the work group is coalescing around. We are going to be presenting this framework to the advisory committee at the September committee meeting on September 20th. So if you have any questions, if you're interested in this, I'm just sharing, letting you know that this is sort of a work in progress. We're certainly open to comments on the draft framework at this point, but there'll be a more formal presentation and discussion with the advisory committee in September. Any questions about any of that? Okay, next slide. Zachary, I think, are you taking this, or should I share a little bit about the advisory committee discussion first?
Go for it, and then I'll follow up.
Okay, so last thing that happened at the advisory committee meeting when we were discussing accountability, particularly around financial penalty options, which we've shared with you previously, the advisory committee really wanted more time to have this conversation. They asked some really great questions, and they wanted to come back and continue that conversation. So long story short, we are going to be having more discussion about accountability, specifically about financial penalties, with the advisory committee at their September and November meetings. And that means we have some implications for our previously proposed rulemaking timeline, which Zachary will share.
Yeah, thanks, Sarah. Perfect tee up. So yeah, initially, let me just kind of do some background here and remind folks. Initially, we're going to start soliciting Rules Advisory Committee membership now and August, and then kind of initiate the Rules Advisory Committee meeting in September or October, somewhere around there, and then shortly thereafter, publish and post the draft rules, and then go through the whole rulemaking process. But given that the advisory committee wants to be a little more engaged, which is great, and we want to have a few more conversations there, we're going to push the rulemaking process back a bit. So we're going to convene the RAC, Rules Advisory Committee, in late fall or winter instead of September 2023, as we initially thought. So in the coming, I don't know, weeks or month or so, we'll come out with a more specific timeline, but we are pushing it back. Once we kind of open up the RAC, call for folks to volunteer their time, we'll definitely let you all know because we will want some all of your voices at the table. It'll likely be kind of similar to previous RACs where only one Rules Advisory Committee member per organization, things like that. But many of you have participated in RACs before, which is great. Even if you haven't, that's okay too. So we'll do a lot of kind of introductions and orientation as to what that RAC is and what it means and what the processes are. Any questions about the rulemaking and what the next handful of months will look like?
I also just want to note that we do have an accountability timeline and sort of proposed document on our website. Now that's from earlier this year. We are in the process of updating that to reflect this pushback timeline. So we will replace the document on our website with the more current timeline, and we will send that out to all of you, as well as the advisory committee. So you all have that sort of officially in writing from us about the updated timeline.
Yep. And one final note, there was nothing that was going to start January 1, 2024, right? So there's really no delay programmatically that this creates. We have a whole lot of time. So there's really no harm in pushing it back a little bit and soliciting more input. So I think that's the better tack to go, and that's the route we're going. And let us know if you have any questions. Of course, email us, ping us, and happy to chat more about it. Unless there are any questions, I think that's it for rulemaking. We can go to the next slide, please, and we'll jump into data submission office hours. Back to you, Margaret.
Thanks. Yeah, so I think we can even move to the next slide after that. Yeah, so as we discussed, as we mentioned at previous meetings, we have scheduled 2 iterations of office hours for data submitters to come ask us any questions in preparation for the September 1st deadline for data submission this year. Office hours 1 is today after we're finished with this little program update section. And then office hour 2 will be Monday, August 21st from 10 a.m. to 12 p.m. I sent an Outlook invite out for that, I believe Monday. So if you didn't get that and you think you should have it, just let me know. You can message me directly, or you can message the healthcare cost target inbox. Next slide, please. Yeah, and then this is just a reminder of all of the materials that we have up on our website. So even if you think of a question later on and you want to research it yourself a little bit, you can go to our website and find all of these lovely resources there. You're also welcome to message us at the healthcare cost target inbox as well. In the interim, just a quick note for the data submission template for this year. We did update it maybe 3 weeks ago or something like that. We had someone send us a very early submission, and we noticed a couple of small changes that needed to be made, which were not major in any way that would affect any data that you'd put in there, but it was just things like updating the 2020 to 2021 to 21 to 22 dates. So if you were way ahead of the game and you downloaded that template immediately after we first posted it on the website, you might want to go back and re-download it just to have the most updated version. So yeah, next slide, please. So we are canceling the next pre-scheduled meeting. I believe that was officially canceled via Outlook as well the other day. But we will have those August 21st office hours for data submitters. And so the next TAG meeting will be September 27th. I don't know if anyone has any lingering questions on what we just presented before we move on to the official office hours section of the call. I'm going to take that as a no. And so, Gerandi, I think we can go to the next slide. That's just a summary of TAG meetings. And yeah, so I think we are officially in data submission office hours now. So payers, if you have any questions, feel free to let us know to pipe up. Sam, I believe, is also on the call. so can help answer questions. And thanks everyone else who is not going to stay on the call for joining as well.
Nice, easy tag meeting. Sam and Margaret, one question to maybe kickstart the office hours. Have we received any questions in the inbox that would be worth clarifying for the broader group? Have any questions or points of confusion been raised that would be worth just kicking off with? I saw your head shaking, so no.
Yeah, not so far. We did have our one very early ahead of the game submitter, and we made the update to the template based on that. But otherwise, yeah, no major clarification questions at this point. Wade?
Question on the new data submission template. Is there a way to determine when looking at that new template, like the version, just so I can figure out if I've already distributed the correct one or not?
That's a good question. And actually, I was just looking at what was up there before this call to try to see if it was the correct one. I don't think that we named it anything differently. So if you want, I could send a follow-up email just and attach the version for sure.
Okay.
Yeah.
I think I'll go ahead and replace what we have with this one just in case. I just wasn't sure if I could.
Yeah, no, that's a good
determine
question.
it.
I didn't really think that far when I was like naming the file name, I don't think, on the website. So thanks for bringing that up. But yeah, if you go and you download what's up there currently, it should be the correct one.
Thank you.
I want to tease folks a little bit because on one hand, this is the third time around, so hopefully you are all good to go and you're all here waiting to see if anyone else has questions. That is the case for you. Like, I don't know, I want to ask like, like show of hands if you're just here to see if anyone else has questions. Yeah, that is what I would expect based on previous office hours.
I think that was how it went last year, more or less.
I think, are we okay if people have questions that are specific to their own organization or their own data, are we okay taking those now? Even if they're not more generic questions? I would say yes, because it's a really quiet call.
Yeah, I mean, if people are comfortable sharing organization specific questions, for sure.
Yeah, we haven't gotten a lot of just general questions, I think, because like Sarah said, we've been doing this for a couple years now, which is great. But we have had a few like specific questions to organizations that we've addressed through emails. And we're always happy to do that. But if you want to talk to us now, we can hash it out right now in front of everybody too.
Well, you know what? So hashing it out in front of everybody might encourage some people to drop off the call when they hear this question that I'm about to ask you. So, and I apologize if this has already been covered in other materials, but I just can't, it's just hard for me to keep all of this straight. And, you know, so at MODA, we've got this situation where we've got a subcontractor that's managing a specific part of our benefit. And I just am not 100% sure on reporting their cost, because we don't have complete visibility into what's like might be their administrative cost versus a claims cost versus capitation cost. And so what do we do with that?
Sam, you want to take that one? Want me to?
Go ahead, we can tag team.
Yeah, so I'll give the really high level non-technical answer, which is it really depends on how much visibility you have and how much comfort is. And in the guidance, the manual, we have a couple of options for the level of detail, I think, which range from sort of lump sum to not at all to spreading it out on a per member basis and essentially allocating all of that in.
So we pay we pay capitation to this provider for them to manage part of the benefit. And so we could just report the capitation that we pay them.
That is an option. Sam, you want to clarify?
Yeah, it depends on, what they do for you. Is there a category for that? Do you have any, can you see through anything that they are doing to get more specific with the dollars they're actually sending to the providers, because that's what we're specifically looking for. And I assume there would be no way to categorize which provider they're sending it to, but that's fine. We have a way of handling that already. But as specific as you can get is as specific as we want. I think is what I would say. If it all fits into one, one nice category in the non-claims section of our data submission, then that's where it needs to go. And if you can be as specific as possible, or there are options to estimate how much of those dollars that you're sending to this group that are actually making their way to the providers, then we would prefer that as well.
I guess the thing that maybe to put my finger on it, the thing that I'm not quite sure is I don't want to do something that might conflict with, because it's for Medicaid, might conflict with whatever is in the Exhibit L.
And that's, I think we might be getting into where we want to talk about numbers offline in email, but I think at a high level, we don't expect this to match exactly with Exhibit L because our categories are different. We're looking at different categories to roll the costs up in. So I'm not worried about a conflict with Exhibit L. Sam?
Is this when you, yeah, I'm trying to figure out where this would not line up with Exhibit L's.
Just in terms of the dollars, I'm not sure. Like, I don't do our Exhibit L, but like if I'm not sure what sort of breakout is in there versus in terms of like if Exhibit L is looking for a breakout of what administrative costs might be included in those capitation dollars. And so
Yeah, and
the
that's,
total
those
amount
are,
might be different, if
Yeah.
I,
yep. And I think that's okay because Exhibit L is looking at Exhibit L is answering different questions than what we're looking at, which is just the total medical expenses.
okay.
I also know that, working on the OFA team and working with our financial group over there, that they are working on the Exhibit L's to make sure that they know what's going in there as well, because I think they've had some changes in what they're expecting for that reporting, as far as for this exact reason, the subcapitation arrangements, that some sort of peer through review of those payments to the subcaps. So I think it's never going to match perfectly for some of the reasons that Sarah just said, but also, they're changing and we're sort of evolving too and taking what we can get. These have been very generic answers because we don't know exactly what you're talking about, but I'm happy to talk more about this offline, because I think this is going to be more of an issue going forward. I think it's something we're seeing more and more, and it's something we're addressing. We've tried to address with a couple of other of our payers to various degrees of success, and we might just need to get more specific on a one-on-one basis.
Okay, well, maybe I could, I feel like I know what to do, but let me just make sure that I'm going to make a statement and you see if you disagree with this. And so So this vendor that we're paying, so they're using part of the money that we're paying them for their own administrative costs and part of it to pay services. But are you saying that like so the options we would have would be to try to figure out how much of it is administrative costs, but would you even want that? I mean, we're certain that money is going out the door, and I'm not sure you would be getting that money any other way. I'm not sure if you would be finding a source for those costs any other way.
Yeah, I think we want it all reported because otherwise, you're right. Otherwise we don't see it. So I
Okay.
think when we're talking about getting more specific about the services, like versus the admin, I think it might be like, do you put it in the non-claims payments or do you allocate it back into the claims payment categories? But we want the total dollars reflected
Okay.
at the end of the day. And I think that might answer Travis's question in the chat as well.
Yeah. I think that's it. And all right, so that's good. So really you care about like making sure that the cost is attributed as accurately as possible across the different providers it's going to. And so I think that there's definitely something we can do for some of the dollars. We can like maybe we pay $100 and 60 of it we can tell you the provider it goes to specifically, but the rest of it we're not sure, and we'll just spread that around to the other members.
Yes, yeah, I think I was trying to get specific with the splits between admin and actual service costs, and Travis's clarification really helped. I think you have a good understanding of what our expectations are now.
Okay.
Yeah, we do want all those dollars, but it's just a matter of how can you tease out the various pieces to make sure we know where it's going. And those are things that we can address in our one-on-one meetings once you submit your data to, and we can talk about what the actual subcapitation arrangement is, and if that is a one of the drivers of your cost growth, then that's something we would have more interest in for sure.
Okay.
And Travis, does this discussion help help you as well? Or do you still have clarification?
Oh, yeah, I was just backing up Bill, just saying some of what Bill was saying a different way to try and support him.
This is great. We only lost 10 people over that. There's still 41 people left.
All waiting for the next question.
Okay, don't everyone rush to the mic.
I will also give my usual plug here that if people have questions for each other, to the extent that data submitters are comfortable, if you have questions about maybe how any of your peers are doing a certain thing, this is space for that. It doesn't have to just be questions for the OHA team.
I think we can give it a couple more minutes for people to think of any questions. But if we're all just like waiting for someone to ask a question, no one has a question, then there's no point in staying for another 2 hours. So let's give it another 3 to 5 minutes, maybe.
I have a question. Can you hear me?
Yep.
Okay, so for non-claims that where we cannot calculate member months or even a demographic score, are we okay with using that 0.05 as a default for the risk score?
for the risk score. I'm gonna defer to
Could-
Sam.
Yeah, and could you repeat the question? I was taking notes on the side.
Yeah, so for some of the non-claims payments that I'm reporting, where I can't attribute that to a member, a specific member, the demographic score that I think we used in the past, and I don't know if this is okay, but it's 0.05. Just because if we enter a 0 there, I think it turns red or something, doesn't take it.
Yeah, I think we've had to talk about this in the past, right? And I don't know why we settled on that number precisely instead of the 1.0, which is what I would have assumed we would go with. I'm thinking it's because the score at that point doesn't actually get rolled up anywhere. If you're not able to attribute and it's non-claims, then the score at that point is just sort of getting around any errors in the spreadsheet itself. So I think that placeholder could be almost any number, and it's not actually going to really matter. I'll have to think about. I've got the template pulled up here, but so I might play around with that just to make sure there's no impact down the line. But I think you don't. That doesn't have to be a specific number. It could be just something that can indicate to you that, hey, this isn't a real risk score. This is just something we're placing in there to make sure that there are no errors, and it's something that our template can't really account for that level of detail. We can't account for every single situation that's gonna crop up. Does that make sense?
It does. So I guess the answer is yes, we can use a
That would be fine.
0.04. Okay. All right. I think we did settle on that number because we needed to have a minimum, and I believe
Yep.
that's what we would use internally. And then what about for member months where we cannot calculate, for example, on a non-claims type incentive payment that you cannot attribute to member at a member level, whether it's like for infrastructure, lump sum payment or something like that. How are we addressing the member months on those?
I think that's where we get into peanut buttering. I think we're spreading those costs that cannot be attributed to one member across all the members equally.
Okay, so it would be okay to put a 0 on those for member months, and then doesn't that distort the PMPM calculation?
No, I think what we're saying is use the member months for where you do have them. So for the claim side or for the other categories, just pull those over.
So if you know that it's
I don't think we
commercial,
can do that. Yeah.
if you
Go
know it's
ahead.
like commercial 2022, non-claims dollars, so it's some sort of facility expense, you can not have its own line with 0 member months because you can't attribute those dollars. Instead, for the member months that you do have, take all those dollars and distribute them equally, spread them equally across the commercial 2022 lines that you do have, but uniformly do it as if you were spreading peanut butter on the sandwich, I guess is why we call it that. I don't know why.
Okay, so in order to, it's like an even allocation, is what you're saying?
Yes.
Okay.
Even
Thank you.
allocation is a much better term than peanut buttering,
And
but
peanut
the way
butter.
we all remember it internally, I don't know if that speaks to how everybody remembers it.
Okay.
We must have had a meeting over lunch or something like that. We were all hungry. It's a great question, though.
Thanks.
Down to 35 participants. Okay, can we do a last call for any additional questions? Not hearing anyone piping up, so I think we're probably good to sign off. As we mentioned previously, if you think of any questions, feel free to message us at our inbox. And then we do have the August 21st office hours set up as well for any questions a little bit closer to the data submission itself. So hopefully you have no questions and everything is 100% clear, but if questions do come up, feel free to just contact us at will. Okay. So thanks everyone, and have a good rest of your day.